We're here with Steve Mooney, president of Conifer Health Solutions at the HFMA A&I show. Steve, tell us what sort of challenges your customers, providers are facing in healthcare finance today and how Conifer is helping them to overcome them.
Sure. Thanks, Jennifer. Well, there's a lot going on in healthcare, as we know. Just in general, there's a lot of focus by the A teams of hospitals on things like meaningful use. Some reimbursement challenges are out there currently today. And overall, it's really putting a lot of strain on them to drive what they're doing around ACOs and having to get their doctors engaged in hospitals. As a result of that, what they're doing around the revenue cycles, they're really not paying as much attention to it as they really have to. So there are some serious challenges happening around side effects. Some are around denials. They're not getting their AR perfected as well. As a result of that, they're not getting paid appropriately in the reimbursement programs. So when they are doing the services, they're not getting paid for them. Other things they're having major challenges with today are getting bills out the door appropriately. They're having troubles getting coding done at their levels, making sure charge reimbursements and charge are captured appropriately, making sure that the actual documentation on bills are coded accurately from physicians and nurses so they can get reimbursed. So the challenge is ever pressing. You've got lots of challenges around self-pay, as you can imagine. Still, high deductible health plans are getting bigger and bigger. We can't get reimbursed in the self-pay side of the fence. So we're just seeing the pressures on overall from the hospital for reimbursement, but also when they actually do the services, getting paid for those services. Another thing we're seeing out there is sustainability. So a lot of our clients right today are realizing, well, they can't afford the capital to invest into the revenue cycle. As a result, they're going to have trouble sustaining it into the future. We're also worrying about sustainability from a people perspective. Well, I might have a great team today and have decent results, but they're worried about Bob, John, Sally, who's running the revenue cycle. If they're not there tomorrow, what are they going to do? And so it becomes a major challenge for them. So when you look at a company like ours, you've got 3,400 people around the U.S. We've got obviously incredible depth, we've got expertise, we've got PhD statisticians on staff doing regression analysis. Hospitals can't afford to do that. They can't afford to put the time and attention or the capital or the money behind it. So there's some of the things we're bringing to the table to help our hospital clients meet the challenges today.